Hello, I'm Dr. Rhonda Johnson. Today is Monday, May 6, 2024, and May is Mental Health Awareness Month in the United States, and I'll be doing several videos on this topic this month, but today I'm starting off with this topic, talking about a subject that we seldom want to talk about, and that's addiction. You know, addicts are human beings. They are our sons, our daughters, our moms, our dads, our sisters, and our brothers. And they have a sickness. Nearly 49 million Americans struggle with addiction, but many don't get the treatment that they need. Here is a horrible statistic. Overdoses are the #1 cause of accidental death in our country. Drug overdose is the leading cause of accidental death in the United States, with opioids being the most common drug. According to the CDC, there were over 112,000 fatal overdoses in the 12-month period ending in May 2023. That is the highest number of overdose deaths ever recorded in the United States in a single year. Now, nearly 40% of people with addiction have a mental health disorder. The co-occurrence of substance abuse and mental health disorders is common because similar areas of the brain are involved with both. Now, these behavioral health disorders that commonly occur with addiction include anxiety and mood disorders, schizophrenia, bipolar disorder, mild depressive disorder, conduct disorder, PTSD, post-traumatic stress disorder, attention deficit hyperactivity disorder, childhood trauma or adverse childhood experiences. Now, trauma increases the addiction risk. Some people who develop an addiction are looking for healing in some way or another. And sadly, people who have endured childhood trauma find themselves sometimes using substances as a way of coping, but the reality is this does not help their situation. According to the CDC, the most common adverse childhood events include witnessing violence or experiencing abuse or neglect in addiction. Now, sadly, people suffering from addiction receive punishment more often than treatment, particularly if they're Black or Latino. Addiction is the only illness that is criminalized, but punishment does not reduce drug use or overdose. Now, one size seldom fits all for addiction care, especially when trauma and mental illness are involved. Treatment should address the needs of the whole person to be successful, and addressing mental health issues during treatment helps with long-term recovery and decreases the risk of relapse. Now, the treatment of addiction is beyond the scope of my message today, but at a minimum, it should include detox, which is like withdrawal symptom management, cognitive and behavioral therapies, that includes counseling, and medication for addiction treatment. Now, a great resource online is shatterproof.org. I'll include the link. So this is my first message on mental health for Mental Health Awareness Month. As I said, I started talking about addiction. This is a growing crisis in our nation. That's my message today. As always, feel free to share this message and leave a comment.